The National Ambulance Service in the Ashanti region has bemoaned the lack of spacious offices and adequate accommodation for paramedics in the region. The Mampontein and Ejisu stations have for nearly 2 decades operated with only one office space, accommodating a growing staff of over 20 officers. The situation, according to the regional manager of the ambulance service, is adversely impacting service delivery as officers are not always readily available to attend to emergency calls. There's more in this report.
Speaking on the sidelines of the maiden award ceremony for the Ashanti Regional Emergency Medicine Service, manager for the service, Sumik Dute Milon, raised concerns about infrastructural deficit of the service. Mr. Dute disclosed that stations with small office space have officers responding to emergency situations from home. According to him, the situation affects swift delivery of services.
So we lack things, we have infrastructure problems, office accommodations and all that. But gradually, I think for Ashanti region, we've improved from scratch to a very good stage now. But we still have some few areas, some few districts that don't have infrastructure at all. They have been accommodated by fire service for over 20 years now, and they are still living in a single room accommodation. It's really a big challenge for Ashanti region. Some places like Ejisu, Mampontein, they are the first stations we opened 20 years ago, but they are still living in a fire service, one single room accommodation with over 20 EMTs working in that office. It's not conducive for us to work with those places.
Congestion at health facilities in the region impedes the operations of the service as officers are compelled to hold patients for several hours. Head of the emergency unit at the Konfanoti Teaching Hospital, Dr. Chris Opon, explains the impact of the challenge as efforts are being made for convenient service delivery.
When they come to our facility, for example, they are unable to offload the patients to us and get back to their station because our hospitals are congested. We have so many patients already in the hospital, and at times it's quite challenging for them to also offload the patients so that they can return to their station. At times, some wait as long as 12 hours, 24 hours, and it's quite unpleasant because there might be congestion at our end, let's say at Konfanoti, but another hospital will have space. If we don't coordinate, we are unable to know. But now we are forming common platforms, WhatsApp, other platforms, so that we can communicate better, especially with the ambulance service, so that we're able to distribute the patient properly.
Despite the challenges, a number of officers served gallantly and diligently and were awarded for their selfless service. CEO of the National Ambulance Service, Professor Ahmed Nuru Adams, charged officers to execute their duties assiduously.
Ghana is the only country we have. Whether EMS succeeds or not, it depends on you. And so try as much as you can. And now you have a lot of seniors amongst you. You have paramedics amongst you, you have advanced EMTs amongst you. If you don't know anything, ask for help, ask for support. Continue your CPD programs. Try to equip your skills every day.
For JoyNews, my name is Emmanuel Bright Kwiku.